Okay, good morning, everyone. Hope everybody's doing well. Thank you for being here. Just to be aware, again, of the microphone, if you're not speaking, probably a good idea to turn it off. I can keep it on. So I think that's it. So we will open the hearing on Senator Ricciardi's bill, Senate Bill 286, and here she is. Good morning.
Thank you, Mr. Chair, members of the committee, for allowing me to introduce Senate Bill 286 for your consideration. SB 286 would direct the Department of Insurance to set up a pilot program for the establishment of association health plans. The high cost of health insurance is a burden for families across the country. In New Hampshire, unfortunately, we face some of the highest health insurance premiums in the nation. These high costs not only hurt our families, but make it harder for New Hampshire companies to attract employees and help our state's economy thrive. We have tried top-down Washington solutions to make healthcare more affordable. They do not work. We need to bring more choice and more competition to our healthcare marketplace, and AHPs are one way to do that. Health insurance works by pooling risk. But when your pool is too shallow, it's hard to spread that risk affordably. We have to spread the risk through large health insurance companies, or some large companies have enough employees to self-insure. In fact, that's what the state of New Hampshire does, hiring an insurance company to administer the plan, but taking on the risk of paying health insurance claims itself. Small and medium-sized companies and self-employed don't have that option. What if we could give it to them? What if we allowed small companies dollars in the small group market and possibly as much as $10,000 in the individual market? Let's find out if this kind of innovation can work in New Hampshire. SB 286 would set up a pilot program of up to 1,000 participants based on profession, line of business, or geographic region. It would be open to any eligible person regardless of age or health history. The Department of Insurance would report annually on the pilot program's progress, and the pilot would expire in 2025, leaving it to future legislators whether this program should be extended or expanded. On healthcare, we have been having the same arguments about the same ideas for decades. Let's try something new. I ask for your support for an AHP pilot program by passing SB 286. I think it's much needed, long overdue. I'm listening to my constituents, and this will help across the board for the state of New Hampshire. So thank you.
Thank you very much, Senator Ricciardi. Are there questions? Seeing none.
Thank you. Have a
Good
good day,
job.
everyone.
Let's go right next to the Department of Insurance and DJ.
Good morning, Mr. Chairman, members of the committee. It's very nice to see all of you. This is the first time I've been in this building in quite some time, so it's good to be back. For the record, my name is DJ Betancourt, and I have the pleasure of serving as the Deputy Commissioner of the New Hampshire Insurance Department. As has been our department's long-standing policy, I am not here this morning to take a position on Senate Bill 286, but rather to share a few thoughts for your consideration. In the first instance, our department will, without obviously any hesitation, carry out whatever directive we receive from the legislature that is signed into law or otherwise becomes law, and that is certainly true for this legislation as well. I also wanted to share on a personal level that during my years working in the governor's office, I worked with Senator Bradley and then Senator Feltus on crafting New Hampshire's current AHP statute. I think we can all agree that innovation in healthcare is a good thing, and based on the work of the past few years, it is clearly a bipartisan sentiment. Since that time, I've learned a great deal about AHPs and their accompanying form, also known as MEWAs, and I very much personally support the concept. But in terms of the task that you're asking of the department here, I think it's important to set appropriate expectations on what this exercise can produce given our current state and federal laws. Developing small employer purchasing models that give employers more negotiating power with health insurance carriers is a fairly established concept. New Hampshire does allow for a similar type of insurance arrangement. I mentioned that before, the MEWAs, as well as AHPs. What distinguishes an AHP from a MEWA, just for background, is that under a MEWA, membership is limited to existing trade groups. Over the years, the federal government and state government have made qualifying for a MEWA more restrictive, with only a few grandfathered ones remaining, the most prominent of which is the Automobile Dealers Association. I hear that one cited a lot, and that is a MEWA that is established. The renewed focus on AHPs was sparked here and across the country in 2018-2019, to my recollection, because the federal government put forward a rule to loosen the eligibility and definitions around AHPs to exempt them from more stringent ACA requirements through ERISA preemption. In short, the rule allowed AHPs to sidestep some state mandates or all the requirements of the ACA. However, that rule was challenged in federal court under the argument that the federal government exceeded its authority in issuing the rule. That lawsuit went forward, was stayed by the Biden administration after some successful rulings by the court in that matter. And so while the rule has technically not been rescinded, it is still kind of in abeyance, if you will. So this means that most approaches to AHPs and MEWA just aren't viable from a financial perspective for those stated reasons and because of the restriction on creating separate risk pools. Now that said, because of the 2019 law, and I think Senator Bradley was successful in revising it last year to my recollection, the state is not prohibited from allowing AHPs, but they would not fall under ERISA and would therefore need to meet all state and federal mandates in addition to rating and oversight regulations. Further, it is not possible for employers to negotiate away carrier administrative costs of 10% of premiums, so AHPs are unlikely to produce the kind of savings that I think most of you are hoping to see. Carriers generally retain 8 to 15% of employer premiums, so there are some practical barriers to this exercise that I think should be considered. An AHP would have to assume responsibility for many of the core functions currently performed by an insurance carrier, such as developing insurance product benefit designs, provider network development, and claims processing. Now, it might be possible for the AHP to perform those functions cheaper than a carrier, and certainly any cost savings that an AHP could produce, I would assume, is a good thing. It's something that the authors of this bill would certainly support. But taken together, those factors for both AHPs and MEWAs make it difficult to build a plan that's... So as I said, I say all that because if the insurance department is to kind of undertake this, we would have to consider your appetite as a legislature to consider things such as flexibility around mandates, flexibility around rating rules, and what you would like us to do to guard against or to permit cherry picking. Those are issues that this pilot program would necessarily need to consider if you're looking to get the types of savings that I think that you want to see. I appreciate, and the department appreciates, the desire to address a very serious problem that has faced many small employers. And obviously helping them offer more affordable health care is something that everyone, I think, in our state could support. So If the legislation passes, we will undertake it with dedication and passion. And who knows, though I think there are some challenges that we'll need to work through, the exercise itself might help us to learn more about AHPs than we previously appreciated, with an eye towards future viability. Thank you, Mr. Chairman.
Questions of Commissioner Bettencourt? Senator Abard.
Thank you, and thank you for your testimony. Good to see you back. The department recognizes there's a problem. Any suggestions?
Well, as I said, I mean, I think that there are some policy choices that you have to consider, and that's not for the department to put itself in the position of making those policy choices. We will take whatever direction that you give us, and we will obviously bring our experts to bear to find something that works and to produce the result that the legislature would like to see as best as we are able.
Just one quick follow-up, Mr. Chair. Could you just define what problems they recognize?
Sure. Well, as I said, I think, the question becomes, and again, it's a policy question. How much flexibility do you want to give in this pilot program? Do you want to give flexibility? So obviously we don't have control over any of the federal requirements that the state is needing to follow. But there are some things within the state's purview that if you wanted to give some flexibility for us as we explore this, could. And again, I think that surrounds rating rules, and we can certainly make our experts available to you to kind of understand the full parameters of all of that. What you'd like us to do with the state mandates, whether some of them, all of them, none of them, whatever the case may be. And then the issue of cherry picking. Would need, as I said, a little direction from you from a policy perspective as to how you'd like us to approach that. Those are the big items.
Thank you.
So let me follow up, seeing no other questions at this point, on a couple of those issues. On line 4, I think it's pretty clear, at least from Senator Shardy's point of view, that there should be no cherry picking. It's all any eligible person, regardless of age or health history or status. So that really should satisfy the issue of ratings and guaranteed issue right there.
Mm-hmm.
Would you agree with me?
I would, yes.
Okay. Secondly, my understanding is we cannot change the 10 essential health benefits under the Affordable Care Act.
That's right. That's
which
a federal
are pretty
requirement.
similar to the mandates that New Hampshire already has in question, already has in statute. So while the legislation right now is silent on that, I would argue we're not going to be able to change that. Wouldn't you agree with me?
I think that's right. I think the question would be, are you going to keep it to the 10 essential health benefits, or, what are we going to do with the rest of the state mandates that are in place? If you're saying that the statute, and I apologize, have not read the current statute in a while. If that's what it's limited to, then I think there's probably more opportunity there than if you had all of the rest of the state mandates in play.
Okay. Senator Sherman.
Thanks, and thanks for taking my question. When they say there can be up to 1,000 participants, to you, does that mean actual covered lives, or does that mean participants in terms of the professional organizations or within that association?
No, it's a very good question, Senator, and obviously Senator Ricciardi could probably give you the definitive answer. As I read it, what I mean that to say is you'll have one pilot with one organization that can have up to 1,000 members.
Yeah.
My concern is the viability of that system. In other words, I can't remember the right term. It's not risk pool, but in other words, if you have a number of people within that 1,000 who get COVID and have to be in the ICU, and that's $128,000 per person on average. I think it's for the first 4 days. I just can't imagine that only 1,000 covered lives is going to be a viable risk pool. There's another term for it, and I'm blanking on it. Do you share that concern, or I'm always willing to do a beta test of something, but I don't want people to not end up getting adequately covered, and we've seen this before in the recent past with some of the plans that were outside of the major health insurances.
Yeah.
And
Unfortunately, it's a hard question to definitively answer because you don't know what that particular pool is going to look like. So if you've got a nice diverse pool, even at 1,000, you're probably not going to see a huge threat of adverse selection.
right.
Obviously, there's a range there. It could be a pool that experiences a lot of healthy people, and a few claims. So that's obviously the best case scenario. The worst case scenario, of course, is that you do see adverse selection, and that could obviously be problematic.
I'm not sure I understand.
Well, I hope I've at least explained it well enough for you to understand.
That's adverse selection. Further question?
Mr.
No.
Chair, if I may, I think I misanswered Senator Avar's earlier question. I think you asked, what have we identified as challenges for businesses with regard to health insurance? I think there's obviously a number of different factors that are challenging the small group market. We've seen that here in New Hampshire. It's stable, but it's certainly not as robust as it used to be. I think that the focus both at the state and federal level on strengthening the individual market has been positive in terms of making coverage affordable in the individual market. But I think that it has potentially caused some businesses to move away from the small group market. There's now a fairly new concept that's come out called ICRAs. I don't have the acronym fully memorized just yet, but that's another opportunity where a small business can give a pre-taxed amount of money to their employers to then take and purchase a product in the individual market. And so I think some of that contraction in the small group market has made challenges in affordability for small businesses, and then of course you've got the issue of people self-insuring, which again further shrinks that small group market. So those are that was the answer to the question I think you asked me, and then I thought you said something else and went in a totally different direction. Sorry about that. Thank you.
So let me just ask one last question, sort of springing off of Senator Sherman's question. Isn't the purpose of this to be a pilot program and to explore whether an associated health plan under our statute, Amoeba statute, is viable? And the questions that would be answered are the main question: will the private sector bid on 1,000 lives? And isn't that the key factor here that we're trying to figure out?
Precisely, yes. The first kind of threshold for the pilot to be successful is, do you have a carrier who's going to step up and do some of the basically TPA functions that you would see them perform in a self-insurance type arrangement? So yes, that's absolutely, I think, the first question that has to be answered.
Okay, Senator Whitley.
Thank you, Mr. Chair. Thanks for taking my question. So going back to this state mandate issue, of course, we know that we can't change those 10 essential health benefits, but there are some really important state mandates that we need to consider: fertility benefits, services for children with autism. Do you think it's beneficial to the state to do an amendment to this to just clarify that these plans would also include those state mandates, those important covered services?
That would be a policy decision for all of you to make.
So what I would ask you to do, Commissioner, is to get us the language so that we could, with one sentence, cover all of the 44 state mandated coverages in this amendment in the same sentence of
That we can do.
age, health, history of status. Okay? All right. Thank you very much.
Thank you, guys.
Ms. Vaughn from the American Heart Association.
Good morning, Chairman Bradley, members of the committee. For the record, I'm Nancy Vaughn, Government Relations Director for the American Heart Association, and I've come to you, in opposition to this bill. Most of the reasons why we are taking that position at this time was really brought forward with Mr. Betancourt's comments. So the American Heart Association at the federal level, our staff there had commented on the federal rules that are actually mentioned within this bill language, and that we have serious concerns around those. So I think with the amendment that you had just mentioned, that might clarify what the intentions of and what would go into this pilot. Obviously, those essential health benefits are very important to us. We don't want to stymie innovation, but we do want to make sure that protections are there. We certainly appreciate the fact that that already this bill is addressing pre-existing conditions and things of that nature. So I will look forward to the amendment, and that may bring forward some other comments from the American Heart Association for improvement. May change our position on this, I'm not quite sure. But I just wanted to, at this point, state that we do have concerns around the bill as it is written right now, and look forward to the process as it moves forward. So thank you.
Great. Questions of Ms. Vaughn? Yes, Senator Whitley.
Thank you, Mr. Chair. Thank you for being here, Ms. Vaughn. I'm wondering if you can share with the committee at a later date the comments from your national organization on the federal rules, just so we can really understand the full.
Yes, I
Great.
will do that in writing. So
Great.
yes, thank you.
Thank you.
Seeing no further questions. Mr. Valus, how are you?
I'm very well, thank you.
How's that herd of animals?
The animals are doing well.
You get a lot of snow up there?
Not as much as we want.
Yeah.
There's a lack of snow, actually, but hopefully this past weekend corrected. But the animals are doing great. They enjoy the cold. So, on a side note, I raise bison and elk. So, but my name is Nick Valus. I've been a healthcare provider for 35 years. I've worn almost every hat conceivable in healthcare, from starting my own insurance company, serving as Commissioner of Health and Human Services, developing the first ambulatory surgical services in the state, and that received a lot of opposition. The sky was falling then, and now it's acceptable and actually preferred. My mission today is to make healthcare more affordable and preserve private practice, because I firmly believe patients are better off in the hands of people that are in private practice, that are not influenced by corporate medicine. So with all that being said, I am here to testify in support of this bill. I sit back in wonderment. Our house is on fire in the state of New Hampshire. We are a great state for businesses. We are a small business state, okay? And the cost of health insurance in the state of New Hampshire, especially for small businesses, is some of the highest in America, if not the highest in America. Yet, we have one of the healthiest populations in America. There's something wrong with that equation. And for us not to be turning the furniture over, wondering how the heck can we get out of this situation to help private practices. I represent a lot of physicians who are in private practice who have difficulty keeping employees because they cannot afford health insurance. It's untenable. We should be literally going full bore and finding solutions to this problem for people in small business. And all I hear is, we can't do this, we can't do that. We got to preserve this, preserve that. We can't preserve the status quo. We cannot. More and more people are being, basically are being shunned to the exchange, to a government program. So de facto, you're going to end up with a government program for everybody that's in small business. That is not healthy either, because it's not great coverage. If it was great coverage, Congress would adopt it for itself, but they don't. So we can't keep thinking the same way. There are ways in which you can do this. Senator Bradley and I have talked for years over this issue. And it's an important issue. We got to help small businesses. We got to help doctors in private practice, or physical therapists in private practice, or nurse practitioners in private practice. They want to offer health benefits that are affordable. You know, we're talking about inflation, gasoline inflation, meat inflation. The inflation in healthcare has exceeded all those, bar not even close. And yet, we worry about the status quo. We got to change, okay? We really do. We got to offer a health insurance program that's affordable. I think a pilot is warranted. You got nothing to lose, and it's possible. I started a health insurance program de facto. Okay, you can hire TPA services. You can create networks. Okay, one of my companies in the past was Compass Smart Shopper, which state of New Hampshire employees participate using. It's got 100 million users today. It's a healthcare cost transparency company. You can be creative now in steering people to lower cost providers. The cost difference between a total joint repair or replacement is $70,000 to $80,000. Those are real numbers. Lab, $70, $90 versus $500. Same market. MRI, I'm an MRI provider. I can offer you an MRI service for $700, latest in technology, versus $5,000, half a mile down the street. If your employees were aware of that, they would probably use a lower cost provider. There is a way of saving more than 10%. I live it. We've got to be creative. I am hopeful we can create a healthier environment for small businesses as it pertains to insurance. We've got nothing to lose. And it's going to require give and take, maybe on some mandates. There are self-insured large companies who are flexible in their benefit designs. If you can become self-insured, you can avoid paying some of the taxes that are levied on fully insured products. You can have 6 to 7% savings right there. We can do this. We have to do this. We got to find a way. We can't accept it. The beauty of our state is we are small. We can be creative and innovative. So I support this bill. I hope you all find a way to do so as well. Thank you. I'll field any questions.
Thank you, Nick.
That's it. Thank you.
Last speaker, Curtis Berry, representing New Hampshire Retail Association.
Good morning.
Hi, Curtis.
Thank you for this opportunity. I am Curtis Barry here this morning on behalf of the New Hampshire Retail Association. Very briefly, the New Hampshire Retail Association, as you know, is made up of very large retailers and hundreds of small independent retailers in the state. And it's on the latter half that I'm speaking for today in favor of this bill. This is my 23rd annual session representing the association, and if there's one constant that the members have expressed to me is that pretty near the top, and usually the #1 impediment to hiring new people, is the rising cost of health insurance benefit. Because they participate in the small group market, that is really where the problem lies for them. So we support anything that aims at allowing them to provide a robust health insurance benefit at a lower cost, because the increases year over year are really unsustainable. I think Senator Bradley heard from a member last week that the most recent increase he's experienced is around 11%. And it's not just the 11% premium increase in his small group market, but he's trading off higher increases in the premium for lower benefit and pushing more of the cost onto employees, higher deductibles and things like that. So both pieces continue to be out of whack. So anything that can be done to address that problem, which they view as the #1 problem, would be welcome. happy to answer questions to the best of my ability.
Good.
Thank you, folks.
Okay, I'm gonna close the hearing on this bill. I think we'll wait for an amendment on state mandates from DJ and then exec it at that point in time. All right, seeing that Senator Reagan is here. Good morning. We'll open the hearing on Senate Bill 290 and recognize the prime sponsor.
Good morning, Chairman Bradley and members of Senate Health. I'm Senator John Reagan from Senate District 17, and I bring to you today Senate Bill 290 relative to the practice of auricular therapy, which is ear acupuncture. I believe we've passed this before, and it disappeared somewhere. So here we are again. So the bill kind of says you can practice ear acupuncture as long as you don't say or do certain things and that you follow certain sanitary practices. And I received a phone call the other night, and I was informed that the Army is training combat soldiers in ear acupuncture to be used at the time of battle. So, and the person that notified me of this is an MD and a practicing acupuncturist, and he said, I can show you how to do this in about 5 minutes. So it would appear to be keep everyone safe from any harm. So with that, I'll leave it to, there are other people here who are actual acupuncturists.
Are there any questions of Senator Reagan? I just have one. Senator Reagan, is RSA 328G the acupuncture licensure statute?
I don't.
Okay,
Don't.
fair enough. Okay, thank you. I have 2 people that are signed up to speak. Elizabeth Rapp, I believe. Good morning, ma'am.
Good morning. Thank you for taking my testimony. Is it okay if I take my mask off for testimony? So, we do have a few other people who want to sign up to speak. We just kind of tiptoed in just now. So besides me and Laura Cooley, we have 3 other people who just want to sign their support. One came here from the University of Chicago, so I just want to make sure that they have their voices heard, and they will be brief. But I'm Elizabeth Ropp. I'm a licensed acupuncturist, and I'm here to testify in support of SB 290. I want to tell you about 2 extraordinary people. Jeff Davis, a master's counselor and licensed drug counselor in Manchester. He was awarded NAMI, New Hampshire's Provider of the Year in 2019. And Ina Meng, Harvard medical student. They're both acupuncture detoxification specialists, or ADSs, thanks to the current law that this bill will amend. So I met Jeff in 2017. At that time, New Hampshire was considered ground zero for the opioid epidemic. And I had just led an effort to pass the current law for acupuncture detoxification specialists. The law that allows anyone to train and certify to practice the 5-point, not a protocol. This is the protocol. And the protocol is specific, or it's taught by the National Acupuncture Detoxification Association. So after the ADS law passed, I started a free weekly ear acupuncture clinic at a recovery clubhouse in Manchester, Hope for New Hampshire Recovery. And so people could try NADA, experience it, see the benefits. And Jeff Davis and his clients got treatments at the free weekly ear clinic. Jeff provided counseling services for chronically mentally ill people, people with co-occurring disorders. So he found that the ear treatments enhanced his counseling services. Jeff got NADA certified in 2019, and if this amendment passes, he can do much more. He's already trained in the full ear. He took a class with me in Vermont with Dr. Tom Corbin, right after Vermont passed a similar policy that SB 290 is hoping to achieve. So, and just for some background on Dr. Corbin, he practiced ear acupuncture at the Broward County VA pain clinic for 25 years, and he teaches at the University of Miami Medical School. So from that class, we learned other ear points and protocols for addictions. As an acupuncturist, I can legally needle any point in the ear in addition to the NADA protocol. However, Jeff and other New Hampshire ADSs are only limited to the 5 NADA points. He and his colleagues are more likely than me to work with patients who are in early withdrawal from methamphetamines or crack cocaine. And Manchester right now is dealing with a methamphetamine epidemic. So Tom Corbin taught us an ear protocols that might be more effective for meth addiction. And I want Jeff and others in his field to add more tools to their toolbox to support their clients' needs. Auriculotherapy gets people out of fight or flight and helps build their inner resilience. It helps people who want to escape feel comfortable in their own skin. Another person I want to tell you about is Harvard medical student Ina Meng. She came to Hope for New Hampshire Recovery in 2018 while writing her senior thesis on acupuncture and the opioid epidemic. She continued her research on auriculotherapy at the University of Cambridge in England and was NADA trained in England. In that training, she could needle more points on the ear besides the 5-point NADA protocol, because in the UK, like most of Europe and Asia, they don't hold restrictive policies around acupuncture practice like we do here in North America. From Ina's research, I learned that 75% of all UK prisons provide auriculotherapy to their inmates through an organization called Smart UK. This is what can happen if communities are allowed to practice auriculotherapy without restrictions. Ina now serves on the advisory board of an acupuncture school on the West Coast, and she did submit a letter of support for this bill. I supervise ADSs in New Hampshire. By law, ADSs must be under the general supervision of a licensed acupuncturist who is NADA trained and holds a New Hampshire license. And only 2 of us, myself and Laura Cooley, who will be speaking, are the only ones who've stepped up to provide this supervision. And it's mostly volunteer work. No one's making money off of ear acupuncture. And they don't get paid more at their jobs to provide ear acupuncture. And from our experience, the first year of supervision is what's the most important. After that, that's adequate. ADSs don't need ongoing supervision. They know that they can call us anytime with any questions. And another thing I'd like to add, and I didn't put this in my testimony, in 2020 when the pandemic hit, acupuncturists like me had to stop practicing under emergency order. Many of the ADSs are essential workers. And so when I contacted the board and asked them, the acupuncture board, what is expected of me right now in terms of supervision for ADSs, I didn't get a response. Many of the ADSs were still at their jobs providing behavioral health, mental health services, many by teleconference, but not necessarily because we couldn't shut down the recovery programs in New Hampshire because of the pandemic. And I never got a response or support from my own board. I didn't know what was expected of me. And fortunately, Lindsay Courtney at OPLC was able to work with us. But again, the board just had a hands-off approach. And I needed to know what to do in order to follow the law. SB 290 will allow ADSs to practice as auricular therapists and have access to all the points on the outer ear. Anyone trained to needle the NADA points is completely capable of safely needling all the points on the ear. And there are many that are useful. At this moment during the pandemic, half of the visits to the ER are from people who are struggling with their mental health. And so I'm just asking you to please allow our colleague Jeff Davis to help his patients by expanding his right to practice auriculotherapy. And please allow anyone trained in ear acupuncture to practice. Do you have any questions?
So I would now call Laura Cooley.
Good morning. I am thrilled to be here. I've been waiting for this moment for many, many years. So to explain, My name is Laura Cooley, and I'm at Open Carry Needles Now. We're a constitutional carry state. We want to be able to carry acupuncture needles and use them without becoming criminals. Both needles and guns are meant to protect people. Ear acupuncture is backed up by science for 40 years. This little gizmo right here finds what we call active points on the ear. You find an active point, it means you need help in that area. There are ear points that correspond to all the different parts of your body. Terry Olson at UCLA, using a gizmo like that, identified 72% of the time where a person had pain with no knowledge of where it is, because you can find it on the ear. Okay, so science backs this up completely. Some people say ear acupuncture is not acupuncture because it's a completely distinct system. You don't use the principles of Chinese medicine to use it. Somebody has a shoulder problem, you find the shoulder point, you put a needle in it. It's that simple. So China did 40 years of research, Germany, France, UCLA, right? Once our people learn how to needle, why they should be restricted from that. And it's safe. We have a letter from the largest acupuncture malpractice company in the country, who has insured us all these years. Up until 2016, they had not one single malpractice claim. There's still none in New Hampshire. So this is after decades. There are a number of ear acupuncture trainings to teach you to needle the ear safely. There's NADA training. There's Public Health Acupuncture of New Mexico, auricular technician training by the People's Organization of Community Acupuncture, CREW in New York, SMART UK, she mentioned, is in the prisons. They've trained 15,000 people. Denmark, 20,000 trainees. Battlefield acupuncture that Senator Reagan mentioned that they teach in the military, it's a 4-hour training. Ours is 70, okay? 4 hours to teach people to put needles, but we require 70. We feel like this is a very competent training to get somebody in shape to do the rest of the year. I started before December of 2020 to get my own training approved in New Hampshire because I could save New Hampshire residents $105. As he said, the VA, he mentioned the military, but the VA is training NADA across the country. I'm part of the curriculum team. I submitted a curriculum for that training. It's going to be 32 hours. Again, we're doing 40. So, you know, veterans put their life on the line to fight for our freedoms. We're asking you to give them the freedom to get this once they're out of the military and to give it, because lay people get trained in this. Anybody can be trained in this. So I'm asking, when do the rights of the citizens outweigh the right of a profession to withhold medicine? And when does the worry about something bad might happen when you stick a needle in somebody's ear outweigh the suicide risk of our children, our first responders? The first responders category, prison guards are they have the highest suicide rate right now. And our jails and prisons were understaffed by 30% before COVID started. The state prison, Grafton County, Hillsborough County, wants our services. They asked us to come in, but COVID kind of stopped everything. So if you pass this bill, that allows anyone to get trained in ear acupuncture in New Hampshire and do it. Tracy from University of Chicago, she's trained. She paid to actually get certified in New Hampshire so she could come here and provide services as a volunteer. So we're asking, give patients and practitioners the freedom of their choice to use this. We need every tool we can get right now. The audit that LPC did of the New Hampshire LADAC board, it suggests that Lindsay Courtney is taking really a good direction to get clinicians licensed and get rid of the delays in licensing. We have a severe workforce shortage. Patients are waiting months and months to get a counselor in New Hampshire. A large community practice where Elizabeth works, they have not been able to hire another acupuncturist for a year. Our numbers are dwindling. The workforce is down, even in acupuncture. Students are not enrolling in college. The 4 colleges in New Mexico are gone now. We're going away as a profession. 85% of graduating students are not in the field 5 years out. There's no jobs. They will come out with $250,000 worth of debt, between $150,000 and $250,000 worth of debt. So we need our citizens to have these tools in their hands, right? And not promoted just 5 points, because it's a balanced homeostatic treatment that was standardized so we could, pass policies around the states and the world. We are working around the world in over 40 countries. And this was to appease the acupuncturists who did not, what is our history? We've been fought for 40 years by acupuncturists trying to stop this medicine. And so in New Hampshire, when we passed that law, they were asked to write simple rules. They wrote very complicated rules that, in fact, these are the rules. Just for this ear, 5 points on the ear. I gave my feedback on the rules. I sent it an email because I didn't think I could attend the meeting. This is the email. I won't bore you with all the details. My input was not responded to, which is the board's obligation. I started in December trying to get my training approved. I have 6 emails asking, how do I get my training approved? This is Elaine's Bonner's email sending. Finally, in April, I sent my manual in trying to spur a response to how do I get my training approved. She sent my email in to Victoria Davis, the newer administrator, in April. Yet at board meetings in June, they said they didn't have my program to approve. Yet they looked at it. They said it didn't meet the requirements they set out in these 20 pages of rules. It didn't meet those requirements. Those requirements are based on the NADA training. I've been teaching the NADA training for 30 years. I wrote the first manual. I'm rewriting the manual. So they're using my standard to say you don't meet our standards. So before December, I'm still not approved. I finally gave up because I can give you all the emails and all the meeting minutes with corrections to meeting minutes that happened. I really don't want to go through that. But they were to write rules that allowed another training that meets or exceeds the NADA training to be approved. Mine clearly exceeds. I've been doing this. I've trained over 700 people. I'm one of NADA's senior trainers. I just wanted to save people money. The board also tied the law to, strangely, the manual of 2017 for NADA. We're not allowed to use the current manual we are writing. They made us. And when I said, why would you tie us to an old manual? They said, because NADA might drop its standards. So, again, not until Lindsay Courtney showed up did we start getting answers. So in July, they agreed to expedite my request. Again, I started asking before December. They sent me a list of 52 items that I needed to tag to my manual page. They gave me a week deadline to do it. Now, I'm one of the senior trainers. I've been promoting this all along. So I'm just asking you to make all those complicated rules go away and allow people to do other points. The only reason I have not filed a complaint with the governor is because Representative Peter Schmidt begged me not to. He said no, then it becomes a big mess. I'm just trying to accomplish services for people. We could follow Denmark that has 20,000 people trained with 900 programs, and you have a letter from Lars Windblad in Denmark. They operate completely outside the acupuncture system because he said it's easier. So we have a great treatment for stress. We just wish our board wasn't such a great source of stress for us. I'm going to end with Kenneth Ryland. He was Nixon's doctor that went to China. He said, I am convinced that acupuncture is going to be one of the greatest contributions that any group of people has made to the future of all medicine. If it is handled correctly, I know it works. I saw it work. We have not handled it correctly. We have national organizations that up standards. You have to have doctorates now. Anybody can be doing these ear points safely. So we're not asking for carte blanche. You can take the right away of someone to do this. If they don't observe clean needle technique, you follow our protocol, it's safe. There's been no incidents. The worst thing that can happen is a person might faint. I made 11 trips to the Katrina and the Gulf spill. I lived there for 7 months. I've done at least 10,000 treatments. I have never seen a person faint. That's about the worst thing that can happen. So I am asking the state to give people the right to do this without 20 pages of rules. Vermont has no rules. But if you don't practice safely, you can take the right away. I'm hoping that you will help me wake up from this regulatory nightmare. It literally took me 8 hours to get all the emails and all the communications I've had just about approving my training after being a trainer for 30 years. So.
Okay, are there questions of Ms. Cooley?
Thank you for your patience.
Thank you. No worries.
It's complicated, and Senator Reagan has told me I talk too much, but I don't know how else you can explain it. I do talk too much. Peter Smith said I'm good in his camp.
Okay, seeing no questions, let's move on to, I believe there was somebody from Chicago here. Is it either Tracy, Lauren, or?
Tracy.
All right, we'll recognize Tracy Brandstorm. Good morning.
Yes, good morning. I'll make this really brief. So I just wanted to say I'm a PhD candidate at the University of Chicago. I've been doing research on the opioid crisis across New Hampshire and Vermont for the past 3.5 years. I've been following different forms of treatment and how they interact. And I've done a ton of interviews with a lot of clinicians, ear acupuncture practitioners, and people practicing other services. I do agree with what Elizabeth and Laura have already presented to you. I think ear acupuncture as a practice is completely safe. I think it brings a lot of relief to people. And I do think the law poses a lot of restrictions, which is important to consider in the context of, there's a lot of conversations around access to treatment in the context of the opioid crisis. The way I see it, the law does present a lot of obstacles to providing relief to people who are in a lot of distress. So yes, please consider passing the act and changing the law.
Seeing no questions. Thank you for coming all this way. Last person that signed up to speak is Lauren Smith. Good morning. How are you, ma'am?
I'm well. How are you?
Good.
So my name is Lauren Smith.
Could you speak up?
Sorry.
Thank you.
My name is Lauren Smith. I'm a licensed acupuncturist in the state of New Hampshire. I didn't get a chance to write a letter to you all, but I do feel very strongly about supporting this bill. Yep. Thank you.
Well said.
Well, that was quick. Okay. I have another person signed up, but didn't indicate if they wish to speak. I think it's.
Good morning. My name is Robert Mortimer, and I'm a licensed CRSW and a licensed ADS with the state of New Hampshire. A couple of months ago, I left my employment to go help a family member who had serious illness in the state of Tennessee. I spent a couple of months down there. So I left my position as the front-end manager of Hope for New Hampshire in Manchester. In Hope, as I indicated in the letter that I sent to you all, I have seen hundreds, if not thousands, of people come in seeking recovery from substance use disorder. Many of those people had co-occurring mental illnesses. And at the acupuncture clinic, it has been shown over and over and over again that these people get relief from some of these things to help manage their illnesses, in addition to regular medical treatment. Acupuncture does not cure anything. It helps us manage symptoms. I can, there's innumerable testimony that I personally witnessed. I've treated people, and they've told me afterwards that they felt a great sense of calming, and they came every week to the clinic to be treated. Now, these are people that don't have very much money. We're talking people that have lost a lot of things through substance use disorder and mental illness. One of the things about the Clinic at Hope is it's totally free. Those of us who are licensed will provide these services. It doesn't cost 5 cents. Nobody's in this for profit. We're there simply to help people and to help them manage whatever affliction they hope to be dealing with. And I implore you, please pass this bill. It will help many, many people, and many that don't have 5 cents for any other kind of treatment. Thank you.
Great. Thank you very much. Is there anybody else that wishes to speak? Senator Sherman.
I have a question on the bill. I don't know if there's anybody who can answer it.
Why don't we ask Ms. Rapp to come and answer questions? Okay.
Well, it's really simple, and it may be a dumb question. Thank you. In line 15, it says it differentiates between a natural person and any other person in the penalty portion. Am I missing something?
I think that has nothing to do with our particular law, but just saying if somebody's an immigrant and they violate this,
Okay.
there's a felony for it, right? That's what you're referring to.
Well, it's a
I think
felony.
any other person would refer to a company, yeah.
So what is a natural person?
You.
You are a natural person, yeah.
Okay. And what is any other person? Is
Would
it
be a
really
company.
talking about an immigrant?
There are various court decisions which said that corporations can have the benefits of person.
Right.
And so when they are trying to make a distinction between like a body and a corporation, they use those terms.
Okay. Thank you.
Okay. Seeing nothing else, I'm ready to exec this bill if everybody else is.
So moved.
All right.
You have
so
to close the hearing first.
Close the hearing on Senate Bill 290.
Move into exec.
Seconded by Senator Gray.
Motion about to pass.
Senator Avard has moved off to pass, seconded by Senator Gray. I'm going to speak to this bill. I was the prime sponsor of the 1998 acupuncture licensure law. I see, as somebody who's had a lot of acupuncture done on me, I see no reason not to go forward with this bill. So, it's been moved, it's been seconded. Is there any discussion? Seeing none, all in favor say aye.
Aye.
Aye. Any opposed? Is there a subsequent motion, Senator Avard?
Consent.
It's been moved to consent. Any discussion? Seeing none, all in favor say aye.
Aye.
Aye. So for the proponents of that bill, we've recommended to the full Senate that it should be passed. It's on the consent calendar, which means unless somebody pulls it off, it goes through in a block vote. So be prepared for the House. Okay.
Who's going to take that out?
I'll take that one.
I wonder if earrings messes everything up. If somebody's loaded with earrings, I wonder, that's a dumb
All right,
question.
so we're going to come out of executive session.
So moved.
Seconded by Senator Gray. All in favor, aye.
Aye.
All right, and we'll open the hearing on Senate Bill 326 and recognize Senator Whitley.
Thank you, Mr. Chair, and good morning, members of the committee. For the record, my name is Becky Whitley, and I am honored to serve New Hampshire Senate District 15, which includes the communities of Concord, Pennacook, Henniker, Hopkinton, and Warner. So I'm honored today to bring forth Senate Bill 393, creating an Office of Early Childhood to unify and integrate New Hampshire's early childhood system for children and families. So as folks on this committee well know, research has really shown us across disciplines now, it's well established that the very early years of children's lives are critical to healthy brain development. We know that what happens in our early years with our children makes a critical difference for their future, in their readiness to succeed in life, in their readiness to succeed in school. And, you know, in addition to the benefits for the children, for the child, we know that research tells us that return on investment in early childhood throughout a lifetime leads to higher earnings, improved education outcomes, and reduced criminal justice costs. Those savings are unmatched, and the research is clear. So currently, New Hampshire makes investments across early childhood services and supports, but you know, as in many states, the services are fragmented across different state agencies. We have different funding streams. We have state, local, federal programs. And while the Department of Education and Health and Human Services are certainly working towards for further integration, it's become increasingly clear that a more cohesive and integrated early childhood system would result in greater efficiencies for the state. It would result in increased partnerships between the state and the private sector. And of course, importantly for our families, improve access to high quality and affordable childcare and early learning services, which, as we all know, this is becoming increasingly apparent for our economy. If we can get those young kiddos access to childcare, early learning, we can get parents back to work. So the reality is, in New Hampshire, early childhood is a bipartisan issue. So I passed out the governor's January 23rd, 2020 executive order. In that executive order, the governor created the Council for Thriving Children. And you'll see at the end of his order, if you flip to the third page, section 9, in that order, the governor directed the Department of Health and Human Services and the Department of Education to create, to form and maintain an early childhood integration team, which they've done. It's functioning well. And then also to work towards the establishment of a joint Office of Early Childhood to continue that collaboration work. So the purpose of this bill is to build on this vision, build on the great governance work that's already happening within the department, and take the next step in actually creating the Office of Early Childhood. So you'll notice that the bill itself creates the office and then develops a phase-in process. So it creates the office, designates a process for appointing a commissioner, and then directs the commissioner to work with the Council for Thriving Children and the departments to determine the scope of the office. And this is important because there are so many different considerations to take when you are creating a new department. So you have policy considerations, legal considerations, financial considerations for the department, and all that takes very thoughtful planning. So many other states have already created an Office of Early Childhood, including Colorado, California, Connecticut, Georgia, Hawaii, Massachusetts, Montana, New Mexico, Utah, Virginia, and Washington. Many other states are working in that direction, including Minnesota, Mississippi, New York, Texas, and Vermont. So I think when it comes down to it, we have to prioritize, you know, the first year of a child's life. I think we all know that there really is a pretty incomprehensible alphabet soup of federal, state, and local programs for young families. But the early years that are so important in a child's life should not end up in a bureaucratic stranglehold. I think it needs the full time and attention that equals the impact on our children's lives, which is why this act is so important. We want to maximize our investments. We want to look towards good governance, good government. So that's why I asked for the committee's support of 326, and I'm happy to take any questions.
So I have a couple of questions. I don't see an appropriation.
Yep. So The only appropriation as indicated in the fiscal note will be the cost of a commissioner. So the way that this was timed was to line up with the budget cycle. So we're going to create the office, designate a process for the commissioner, whatever that commissioner is designated at, that would be the current fiscal note. And then that commissioner is directed to work with all the stakeholders that are already doing this work to develop the scope. And you'll see that on page 2, starting on line 30, these are all the various duties that this group will consider. So there's no way to know what the fiscal impact or the savings will be unless and until the working group works with the governor to develop that scope. And so this is very important because as we move into the next budget cycle, we need to be ready for that. This is a complicated process, and so that's why it's important to start it this year. So as we go into the next budget cycle, we'll have a true idea of what this will actually cost, what will go in the office. And furthermore, we do know that there is bipartisan support in Washington for investment in early childhood, both in pre-K and childcare. So that's coming down the pike, but we don't know what that is now. So we can't determine the full scope of the office without knowing what that federal investment is going to be. But we do know that there's bipartisan support for that investment, so we do need to be ready for that. And this office will help us get ready for that.
So it would appear to me that there's only one staff person, that's the commissioner, him or herself, is that correct?
Correct.
With a huge amount of duties to provide and uncertain, because it's an off-budget year, as you just cited, the amount of staff.
Well, I want to clarify that these aren't prescriptive duties. These are the duties to consider as the commissioner is working with the working group to create the office.
Go ahead, Senator Avard.
Yeah, thank you, and thank you, Senator, for your testimony. Just curious, could you define a little bit what integrated child care means?
Yeah, that's a good question. Thank you for that. So, in New Hampshire, we have child care providers that, look different. We have larger child care centers, we have smaller child care centers, and those are very important as we think about how potentially expanding our pre-K system. We know that there's already limited access for younger kiddos. So I have an 8-year-old now, but I know that there's very limited infant spots. So in a smaller state like New Hampshire, we have to think about setting up our early childhood system in a way that maintains our existing providers and doesn't put them out of business. So we need to think of a way to, support access to services, but also not put those folks out of business. Does that answer your question?
Partially.
Okay.
If I may have a follow-up. Under the B, there's, optimal health, safety,
Yeah.
and learning. Does that follow under the Board of Education, the learning part of that, or how does that work?
Well, that's exactly the issue. I think there are services to support young children, both in the Department of Education and DHHS. And so that's why, as we're thinking about how to optimize getting the best outcomes and supporting our families, that's why we need the focus of one office rather than split in multiple offices. Yeah.
Okay, so further questions? All right, I'm going to continue on with my questions. So on page 2, you outline the working group, although there are not a lot of details.
Sure.
On page 2, line 20, the commissioner, it would appear, is able to utilize employees from other departments, most likely the Department of Health and Human Services, it would appear to me, to try to set up assist the working group. I guess my question is, and I'm not trying to sound negative about an office. I think it's probably a good idea. But I'm wondering if the approach is a bit, if we're putting the cart ahead of the horse a bit and not doing what we would normally do, which is set up a study commission, study committee, to outline A, the duties, B, the staffing requirements, so that a proposal can be folded into the next budget. I think you're kind of going in that direction, but it seems like, it just seems to me a legislatively authorized commission would be the better first step than actually appointing a commissioner and then taking people from other agencies that are already overworked. I think, you know, I'm going to ask John Williams that question right now. So your comments.
So, yeah, so no, that's a very important point. The reality is, Mr. Chair, is that this issue has been studied at length. So the Council for Thriving Children is acting as this as that legislative committee as you're describing. So it was set up to do just what you're describing. And they've already issued a strategic plan. It was the summer of 2020 that contemplates this process. They are also undergoing a strategic planning process right now to do just as you're describing. They were mandated by the governor to do so, and they are doing that work in earnest. I am on that council. The executive director is Christina LaChance. She wasn't able to make it today, but that work is already happening. There also has been investment in figuring out this governance issue. There's already a report that was funded by philanthropy that the department has. This issue has been studied. We just have to move forward and make it happen. All the right folks are at the table. We just have to take the next steps. I do think that in Section 4, it could be that we could beef up this transition working group. My goal was not to create any redundancies. This work is happening. We just need to get the legislature on board. And so it was fully written to track the work that is already happening within the council and within the early childhood integration team of the department. So I did speak with folks from the department yesterday, and in Section 4, we could specifically add commissioners from the department in that transition working group, and also, you know, fully call out the early childhood integration team that already exists. But the reality is sometimes we just need to take action. This has been studied at length. The research supports this approach, and so we just have to take the next steps and drag the legislature along with us to get us prepared for the next budget cycle.
Okay, Senator Sherman.
Thank you, Mr. Chair, and thank you for taking my question. I'm just wondering, listening to the discussion, whether if we are ready to move forward, why not just move forward? If we have the Council for Thriving Children, they're ready to go, they've got a blueprint for how to establish this, let's just establish it rather than forming a transition working group and establish the office as we would any other department. I'm fully in support of this department. As the son of a child therapist, I get it. But I'm wondering if this interim step should be utilizing the Council for Thriving Children since it already exists, as you said, trying to avoid redundancy.
Yeah, thank you for the question. So the strategic plan has already been issued, but they are working on another strategic plan. And they've just signed a contract with a research partner, and I don't remember the name of it, to further along the process. So that process is happening now. I don't believe that they'll have that report until perhaps the fall. So again, we're just trying to track the ongoing work and push the legislature in the right direction. So I feel like this is the right approach. It's a phased-in approach. It's tracking the work that's already happening. It's a cautious one because we will be, there's a lot of federal and state and local considerations and money to figure out here. We don't want to rush into it, but I think this is a middle-of-the-road, phased-in approach, building on existing work, building on existing investment in this governance process. And in the end, this is what everyone is telling us will get better outcomes for children and families.
Just real quickly, so this is an endorsement from the governor's office of this bill?
Well, you can read it how you want. So if you look, Senator, you can look at the third page,
Yeah.
number 9. At the very last sentence, it says further, the departments will seek to establish a joint office of early childhood care and education that further enables coordination within and across the state early childhood care and education system into local communities.
Okay. Seeing no further questions. Thanks very much.
Thank you. Great
All
questions.
right. John Williams and Karen Bieber.
Good morning, Senator Bradley and members of the Senate Health and Human Services Committee. For the record, my name is John Williams. I'm the Legislative Director for the Department of Health and Human Services, and here today with me is...
Good morning. My name is Karen Hebert. I'm the Director of the Division of Economic and Housing Stability for the Department of Health and Human Services.
Senator Bradley, Senate Bill 326, I think the committee already identified some of the issues and concerns the department had with legislation. We do want to acknowledge, though, up front with Senator Whitley, she does her homework, she reaches out to state agencies and does her work. However, in this occasion, we have to bring certain items to the committee's attention to making a fair and thoughtful assessment of moving forward around this particular legislation. On its face, it appears that the drafters of the bill from the Office of Legislative Services perhaps use the Office of Child Advocate and their legislation. If you do a side-by-side comparison of the bill that created that entity, which was HB 16, I have the number here, House Bill 1162. 1162 was an omnibus bill during the start of the pandemic that created this Office of Child Advocate. Lessons learned from that, however, as we saw, were a question about placement, and it ended up being placed with the Department of Administrative Services, and the Department of Administrative Services were responsible for their administration as well as their budget. As in this bill, and you saw also in the Office of Child Advocate, there was no specific appropriation provided for the state agency head for that entity. For point of clarification, however, the Child Advocate is identified in RSA 94 colon lowercase 1a Roman 1b, which establishes the different unclassified positions within the state of New Hampshire. The Office of Child Advocate is actually headed by a director, not a commissioner, because typically in state alignment, a commissioner is the head of a department where directors are head of such entities such as offices. So these are some minor issues, pointing out there's some larger issues relative to no appropriation with the bill. And so the position for the Child Advocate is actually an HH unclassified position, effective July 1st of this past year, has a salary range of $85,514 to an upper scale at the end of the steps of $119,408. That does not include the benefits that are required for that position. You're probably aware that the current Office of the Child Advocate also had similar legislation to allow for the addition of staff, and they do have a additional staff member within their agency, as well as the need for office space, and that was, I know, has been an ongoing issue relative to where they were going to be housed. As Senator Bradley pointed out, this legislation, which would be effective 60 days after passage, so whether it's an earlier bill that passes, let's say, in May to a bill that passes sometime in July, we're looking at a time frame between October and December for implementation by the Department of Administrative Services. Identified by Senator Whitley very thoughtfully in the intent of the bill was identifying the group that worked on integration and included the Department of Education and the Department of Health and Human Services. If the bill is being designed to create integration rather than fragmentation, one does have to ask the question, why then placement with the Department of Administrative Services? I understand in terms of autonomy of the entity possibly is one of the reasons for establishing that. But we currently have within our agency several units that actually focus on the importance of facilitating services for child care in New Hampshire, including child care licensing, early childhood and development, which Ms. Hebert can talk about, as well as you'll see identified in the legislation, that the role of this committee would also look at special education, and that's in the Department of Ed, ed as well as home visitation, which is done by our Division of Public Health Services. This is a very important piece of legislation. It is extremely expansive. If it is going to be designed as a phased-in legislation, there's nothing here specifically in writing that designates that until funding is appropriated, that the particular office would be stood up. So in the same way that we worked with this committee back in the fall on Senate Bill 288, you may recall that was a bill that was retained, or re-referred to this committee rather, and worked on very thoughtfully, and it dealt with the child care scholarship. We're able to overcome the barriers relative to implementation based upon funding that bill, and built in language that actually required certain appropriations to be set up for consideration in the 24-25 budget. So although we're here today on the part of the Department of Health and Services, I clearly point out that there is a need for appropriation. I think that Senator Bradley raised some very good points that what we really should have here is a thoughtful approach in terms of identifying specifically what this office may look like. How would we utilize existing staff that we have in the Department of Health and Services that are already doing an incredibly good job in the work that they do, and how they would fit in with this new office so that we're not duplicating efforts, but rather doing exactly what Senator Whitley is proposing, which is creating a streamlined approach. We believe that although this is a great conversation starter, it is not ready to proceed, and it would need an appropriation. And with that, I would just turn it over to Director Hebert, and I probably went a little bit farther, but I just wanted to identify some of the concerns that we had as an agency with the bill, including the ability of the new office commissioner to basically direct our staff. And that also creates a problem with having two agency heads looking over agency. So I promise that was the end of my initial commentary other than the response to the question, and I'd like to turn it over to Director Hebert.
Thank you, Mr. Williams. Very detailed and elaborate. That I've not much to add to that, but if I do understand the, thank you. If we do understand really the purpose is to essentially adopt a new model, where the current model that's being utilized is something known as a coordination model, where we have the Council for Thriving Children is co-led by the Department of Health and Human Services and the Department of Education, and with leadership regarding birth through 8 of an advisory group and early childhood expert groups, parents, legislators, and other stakeholders. So both the Department of Health and Human Services and the Department of Education have early childhood integration teams that have created this governance structure that, as Senator Whitley accurately pointed out, is a successful governance structure at the moment. So I think that certainly there's interest in what programs would be included, as they're not really defined so that we can understand what the scope actually is for this. There is certainly much to consider with respect to just the creation of a transition work group. And we would want the early childhood integration team members to serve on that work group in conjunction with the Council for Thriving Children and representation from both departments, including policy, human resources, legal, and finance. There are a number of programs within, I can just speak to the Department of Health and Human Services that provide services related to early childhood that include programs within the Division for Children, Youth, and Families, the Division for Public Health, the Division of Long-Term Supports and Services, and my Division of Economic and Housing Stability. And all these programs that include multiple different funding streams. So there is a great deal to be considered in moving something like this forward. What I think we can initially talk about is how to build off of the existing early childhood governance structure and go from there.
Questions, Senator Whitley.
Thank you, Mr. Chair, and thank you for your testimony. Certainly willing to work on, and I mentioned this to DHHS before, working on expanding the language about the transition working group. The idea is to build on the work, to do what's best for children and families. That's my goal, and I'm fully happy to work on that. And they had promised to send some language, and we'll work together on that. So the piece that I want to know more about is this idea about where this should live. I think that's a big question in the field. The majority of states that do this create a separate office, and that's just because it needs the full attention. And so I'm wondering, your thoughts about where else where else it could live if it's not sort of built from the administrative services, shouldn't live just within DHHS, shouldn't live just within DOE. Where do you have any other sort of thoughts on administrative structure? And then also if you could share with the committee the speaking from the Department of Health and Human Services that work towards the governor's order creating this joint office of early childhood. So both the department's progress and if you have thoughts about where this should live.
So Senator Bradley, I'll start off with a response and turn it over to Director Hebert. So those are really great foundational questions, and I think we're at a point now that we're not prepared to give a response as to where this should be housed. I mean, clearly our agency has a significant interest in this subject matter because we already have existing programs that help to the benefit of New Hampshire citizens. I think one of the things, and part of your testimony to the committee, Senator Whitley, was helpful, was looking at the various states like Connecticut and Massachusetts, our neighbor states, and Washington to see what models they developed and how that might fit to be a New Hampshire solution. So going back to the thought of a group getting together thoughtfully to develop where this should live, I think that it's too early in the conversation to state that. I would ask for Director Hebert for her thoughts, please.
I would agree, and I think that there's potentially lessons learned from some of the other states that have transitioned into offices of early childhood or departments. And I think there's more to be discussed about that, and we could explore that. I think that that would be really important. Oh, it's not there.
Senator Sherman.
You sort of just took the words out of my question, but
then you don't need to ask one.
No, they didn't. But they didn't answer it, so it's still a question. I'm just thinking of the structure of this and some of the limitations that have been placed on you already by the legislature in terms of the number of employees and other restrictions. And I'm wondering, is there any interest, since we're talking about a commissioner, of having this be a separate department that would pull out of education, some of that pull out of DHHS, some of the responsibilities of DHHS, and really put the focus in on early childhood? Would a department be a more appropriate structure than an office?
And Senator Bradley, if I could start off in responding to Senator Sherman's question. I apologize if we were not responsive to the prior questions, but I have a feeling you have a different angle or a different question, Senator Sherman, with asking us about this being housed with a separate state agency department. I think one of the examples that we've clearly seen, and it's been well over a decade for the conversations around it, is around the Division for Children, Youth, and Families within the department. As you may be aware, there were several committees that have looked at this issue. There was more recently this past session as part, I believe, either an independent bill or part of the budget process, that there was identified a working group that would come up with a plan for the creation of a separate department relative to the Division for Children, Youth, and Family. I think that gives you a roadmap and a model of what you would see in terms of the thoroughness and the exactness that you need to go through and to actually come up with an answer to your question ultimately about a plan for creating a department of early childhood. So I hope that's somewhat responsive to the question. I would also ask Ms. Hebert if she would like to weigh in, please.
Thanks. One more question. So, I think, being thoughtful about this is super important. And I think that's the intention of this bill and this phase in process. And I also think it's really important to continue to move forward. So this proposal has been around for a long time. It was actually even as you may remember, it was in the governor's budget proposal in 2018, 2019. So this has been around for a while. And so I was interested in more information about, DHHS's and DOE's work towards creating this joint office as contemplated a long time ago, contemplated in the order. So where we are in terms of progress on planning this joint office?
And perhaps through the Council of Thriving Children, that's been more of a conversation that I'm sure you're aware of, that I'm not necessarily privy to, but I think that with the governance structure that we currently have in a coordination model. I think that is a step towards getting to that point. But I think that there needs to be further ability to build upon that model if we're looking at changing the model from a coordination model to a consolidated model. That is the aim, but I'm not sure we're there yet, and I'm not sure the bill is able to define what that scope is. And where there are a number of items within the bill that are already in existence, such as on page 3, line 34, establishing a quality rating and improvement system that does exist. So there are a number of things here, as well as on page 4, that are in existence. So we're already making those steps to move towards that. So I think that, if we were to look at adopting a new model, that's been work in progress.
Follow up?
Mm-hmm.
Thanks. So the governor's executive order contemplated just what you're referring to, taking a phased in, starting with coordination, moving towards consolidation. And so would you agree that sort of this model tracks the governor's order, with that work going on with the council? Certainly this bill is not meant to define the scope. That work should be happening within this coordinated work and along with the Council for Thriving Children. So my read is that we are taking the next step, moving from coordinated to consolidated in line with the governor's executive order. Would you agree?
Not necessarily, no. The bill as currently drafted, I'd raise the question, is this a product from, because obviously you're the prime sponsor, is this a product from those groups? Because if it is, then certainly that's outside of our knowledge here to provide testimony. I think, like the chair of the committee suggested, this perhaps is a good idea. We also think that integration of services is a good idea, and that perhaps moving forward that you do have something here that needs to be explored further for improving the delivery of services in a more integrated fashion. And I hope that's somewhat responsive to your question. Now, we are willing to engage and work with the committee and work with the prime sponsor to whatever extent, but it really, our thoughts would be now that we're looking at the need for additional reflection through some type of a working group to identify what those pieces would be. I think this particular proposed legislation, if you do go line by line, it provides such things as systems-related costs, which may be a really great idea for providers, but I don't know what the issues may be relative to the cost, because we as an agency were not requested to do a fiscal analysis. It was sent only to admin services, and that's one reason today we went a little bit longer than normal around the fiscal piece of legislation, only because we didn't have that benefit of that input.
And if I can add, if I may, just the necessity to really talk through, I think, for both the early childhood integration teams to really look at various funding streams, also federal approvals that may need to be made through the Office of Child Care in accordance with our state plan that need to be, these are conversations I think that we need to have moving forward in order to really develop the next step in this. For example, funding streams that are received through the Bureau of Child Development and Head Start Collaboration provide the Child Care Scholarship funding, which is then the eligibility for those funds are managed by the Bureau of Family Assistance. So our eligibility team that works with our integrated eligibility system that includes SNAP and TANF. So there are several considerations and these kind of details that we really would like to consider going forward.
Great, thank you very much.
Thank you.
Next person, I believe, is Christy Dubrinall, Department of Education. Good morning.
Good morning. My name is Christy Dubrinall, and I'm I'm here on behalf of the Department of Education. And so I'm not going to reiterate kind of what everyone has already shared. I'm here really kind of to share really the perspective of where the Department of Education is coming. I am part of the Early Childhood Integration Team. I'm on the Council for Thriving Children. I'm also been very integral and part of the work of all that's happening with this work of this coordination for the early childhood system. As Senator Whitley had stated, the executive order in 2020 was issued by the governor in regards to establishing this Council for Thriving Children. And then in 2020, that was established and the work began. And really, how is this all going to work? And so the strategic plan put forth. I do want to share that just this month, we officially, the Preschool Development Grant, which is really the funding that is supporting this work of the consideration of this integration of the Department of Health and Human Services and the Department of Education, is really a supporter of getting this work done. The Preschool Development Grant has funded a strategic plan through the leadership of Christina LaChance, who is working with representing the Council for Thriving Children, of putting forth a strategic plan at this point. And so that work is just beginning with the intent of that being presented in November. So, and in that work, we're really starting to look at the appropriations, we're starting to look at budget, we're having those difficult conversations of where does the Office of Early Childhood live, and all of these questions are put forth within this strategic plan of having that conversation. So I think on behalf of the Department of Education, we're in support of looking at all of this coordination of the Office of Early Childhood. We're part of these early childhood integration teams, but I think that what we're looking at this point is really allowing the process of this strategic plan that's being put forth, that funding is being supported of bringing all of these 4 quadrants that are represented in the Council for Thriving Children, which is the Department of Health and Human Services, the Department of Education, Parent Advisory, as well as research. So those are the 4 quadrants that are represented in the Council for Thriving Children, to bring those stakeholders together to have this conversation, to continue these conversations that are happening. We definitely are in support of looking at what is this system going to move forward in the future. I think that this year is our final year with the Preschool Development Grant. It ends in December of 2022, and so this is one of the this is part of the funding that has really supported this process of really starting to establish this office of what this Office of Early Childhood is going to look like in the future. And so we have Deputy Commissioner Brennan, who represents the Department of Education for the Office of Early Childhood, and really is on that Council for Thriving Children. And we have other leadership from Department of Health and Human Services having these conversations, working through these processes of where does it live, and all of these pieces. So while we're in support of looking at this work, is it premature to, we really want to make sure that we give that strategic plan and those conversations the support and having those hard conversations with all of the stakeholders, really to how does this move forward. And so I'm going to be brief because I don't want to repeat what everybody else has already stated, but just wanted to put that forth.
Senator Whitley.
Thank you, Mr. Chair. Thank you for your testimony. So as you heard from my own testimony, this bill was designed to fully track that strategic planning work. I am on the council. I'm aware of that work. There's been significant investment. The Preschool Development Grant, as you are aware, is millions of dollars. And we don't want to waste that money. So my intention is to move this along and fully track what's going on with the Preschool Development Grant, significant investment, what the council is doing and what the departments are doing. I see a bit of a disconnect between the early childhood integration teams and the council. This is meant to align those group and take the next step forward. We have to move forward. We can't let sort of bureaucracy get in the way of what's best with children and families. So I'm just hopeful that you will work with us to further refine perhaps section 4 on page 2 to fully align with both the council and the early integration teams to make this workable and not waste federal money. So just hoping that you'll be part of that process.
And I want to, on behalf of the commissioner, deputy commissioner, she wanted to make sure that I shared that your Department of Education is in full support of being part of this conversation and doing the research that's needed to, whatever, be part of that conversation. So she definitely had wanted to make sure I shared that with you. Yes, I think that there needs to be consideration of sustainability after this Preschool Development Grant does go away. It has been in existence now, don't quote me on this, I believe it's 3 years. and it has invested significantly into this work. And so we need, as the state of New Hampshire, need to start considering beyond December 30th, how is that work being sustained?
Just one quick follow-up. Thanks. So, and you also identified the strategic plan that we were talking about. So I just wanted to make clear that you knew that, you know, this wasn't a prescriptive scope, that the intention was to lay out everything that's being considered on the table, and the scope is going to be determined based on the outcome of the work you're just describing. Thanks.
Thank you.
Thank you, and thank you for taking my question. Just thinking about the timeline that you just put out, as we're coming forward into a budget year and in the next biennium, and that the Council for Thriving Children anticipates the need for this office. In spite of what the department has said, the Department of Health and Human Services, the timing of this seems really appropriate in creating this office now, with it picking up the remainder of your strategic plan coming in November, which anticipates this office, and then having the office intact with a commissioner or director or whatever the title is, and any changes that Senator Whitley puts in place as that grant runs out. Rather than doing them necessarily sequentially, if this is what's anticipated, wouldn't it make sense to have the skeleton of this, as anticipated in this bill, in place, so that everybody can work together while the grant's intact to launch it in time for considerations of the next budget and all these? Do you understand what I'm saying?
I do understand. Yes, and I think from the perspective of, I think there's still there, as the Department of Health and Human Services had stated, there's a lot of complicated processes that we have to discuss, and so, you know, the Department of Education has early childhood services in place. I on behalf of Preschool Special Education, but I also came from the Department of Health and Human Services, and I worked for the Bureau of Child Development Head Start Collaboration for 5 years. So I'm very aware of all the different systems within early childhood, and I think that one of the pieces that we really need to take consideration is it premature at this point. We need to make sure that we're bringing all the right voices to the table and really having this conversation of where does it live, where's the funding coming from, how are we going to be blending all of these different funding sources, different federal grants that are available, and so having that conversation and bringing the right people to all of our stakeholders into the table to have that conversation. I think that the department is in support of, yes, what is this office of early childhood, an office of early childhood, but where does it live? Is it a department? Is it an office? I think those are still conversations that need to happen.
Senator Avard.
Just on that line, thank you. So you're okay with the conversation, but in support of the bill as written, you still want more conversation?
I think there needs to be more conversation.
Okay. Thank you very much.
Thank you very much.
I'm going to recognize Rebecca from New Futures and ask Senator Gray to take over for 2 minutes.
Good morning. Thank you for the opportunity to testify on this bill. My name is Rebecca Wojkowski, and I'm the Kids Count Policy Director at New Futures. New Futures is a nonprofit, nonpartisan advocacy organization that educates, advocates, and collaborates to improve the health and wellness of New Hampshire's children. I am also a parent representative on the Council for Thriving Children. I do not represent the council in my testimony today, but I'm happy to answer any questions and provide a little context. I have written testimony here, but I'm not going to rehash all the things that Senator Whitley and others have spoken about today. What I really want to talk about is a little bit of history around this concept of an Office of Early Care and Education, or Office of Early Childhood. This is not a new idea to New Hampshire. Prior to the creation of the Council for Thriving Children, we had Spark New Hampshire. Spark New Hampshire, through support of the governor's office and others, had a
multi-stage, facilitated conversation around how we could improve early childhood governance in this state. From that process came to, was a report that was given to Governor Sununu that looked at different ways that we could increase coordination and support a better system for New Hampshire. This is based on the observation that New Hampshire's system for children and families is fragmented. We know this from conversations around DCYF, supports for children around early sports and services, childcare. We know we had ways in which we could improve the system as a whole. Governor Sununu has been supportive of this concept, and to answer your question, Senator Avard, that you posed to Senator Whitley, I don't have his stamp of approval on the bill as written, but we do know in the 2019 budget session, he proposed an Office of Early Care and Education that had one individual who sat between DHHS and DOE. I emphasize that because I think it's really important when we think about where this office sits to understand that there's a lot of interconnectedness between the two departments, but there's a lot of siloed aspects and lack of communication between both of those departments about how we are serving children and families in the most effective and best way. This is a potential huge issue as we look into the future around federal funding that is coming down, potentially, around both child care and pre-K. So in order to enhance our system, we really need to be thinking about what are the structural barriers within our state that is preventing us from really ensuring that kids and families have everything that they need. So this is not a new concept. I think one of the observations I've had around today's conversation was around the questions that we have. And I want to reflect on, as a member of the Council for Thriving Children and a member that's going to be on the Strategic Planning Committee, and that organization that is doing the strategic planning is Greenway Strategies Group that is supported by a preschool development grant. We are going to be engaged on those discussions between members of the DOE, DHHS, and all the other council members on how do we best proceed. One of the challenges we have had in New Hampshire, from my perspective, is that often we have these great markers that we want to achieve for kids and families, but when it comes down to implementation, we don't get there. The advantage of Senator Whitley's bill from New Future's perspective is that it begins to align the legislature with what is happening with the Council for Thriving Children, what is happening with the efforts around early childhood and the potential federal funding. We do not want to find ourselves in November, December of next year after a strategic plan has been done for the Council for Thriving Children, and we are at the end of our preschool development grant dollars and have an inability to cross the finish line for kids and families in New Hampshire. So from New Future's perspective and from my perspective as a parent representative, I think it's absolutely essential that we align what is happening in the legislature to what is happening outside, or else we have the potential to fumble. The preschool development grant gave this state $26.7 million to achieve not preschool, but to achieve higher coordination of our birth through 8 system. We all know how important that is for kids and families, especially in the face of a continued addiction epidemic within our state, a higher rate of children experiencing trauma, as well as the complicated issues around COVID. So as we think about why this bill is important, I really implore you to think beyond being stuck in asking questions. We have dedicated resources to doing this strategic planning. We have the ability right now to set up a system which will allow us to cross the finish line and reach those goals that we really want to for our most important and most vulnerable population within this state. So I'm happy to answer any questions. I did go off my written testimony a bit to reflect on the conversation today, and I thank you for your time.
Thank you, Mr. Chair. Thank you for your testimony. I appreciate that historic information. And in fact, I had neglected to mention that work of Spark New Hampshire, which was before the Council for Thriving Children, and sort of contemplating how long the state has been working towards this issue. So on that note, do you think that this sort of phased-in approach in this bill is premature, or do you think this is ready for prime time?
I think this is right for prime time. I will agree that there's probably room for conversation around the specific language, but ensuring that we're creating the pathway for success is really important.
Thank you.
Thank you, Mr. Chair, and thank you for your testimony. You brought up a word, siloed. Is this just another silo?
The result of looking at those silos and breaking them down and understanding that one of the challenges is that we have programs and funding and services that are siloed in DHHS and DOE. So that first, through the governor's executive order, creating those early childhood integration teams. One of the key aspects of that was creating a, and I'm speaking as not a member of that, but my understanding was creating an environment where programs could share what was going on around their services to children and how that affects the early childhood system as a whole. If you approach our early childhood system as a parent, you have a child and they have complicated issues, you don't always know the first place to start. And often if you go to DHHS, there wasn't an immediate, the work of Spark, the work of the Council for Thriving Children, and the governor's acknowledgement that we needed something different shows that this is not another silo. This is really an attempt to create a better, more aligned system internally and externally.
So a quick follow-up, if I may. So my concern is just another layer of bureaucracy. That's what's in my head right now, just to be frank with you. And these other organizations, these other silos have to answer to this particular silo or this particular organization. I just remember a few years back when we were talking about DCYF and making that its own commission in itself and taking it out of HHS. It just seems like this is just making another layer.
You know, and Senator Avard, I can't absolve you of all your concerns around added bureaucracy, but what I could offer is if, and this might be Senator Whitley, if we could find the report that was written prior to the creation of the Council for Thriving Children that talked about reflections on other states of how they structure early childhood, how this improves system efficiency overall. If I can find that report, I will provide it to you because I think that might help you be able to see in the larger perspective how this is not another layer. It is actually systems-based improvement for our state.
Senator Whitley.
And Senator Avard, I have that report and I can give it to you. So, and regarding the DCYF issue too, I think, this legislature has worked for decades to try to create these efficiencies, particularly in a resource scarce state. So, for example, SB 14 tried to break down those silos when it came to children's behavioral health. So, my question, Rebecca, is that, you meant using a football analogy that I did track, even though I don't understand all the rules of football, that we already have, there are lots of questions here. We know that. But we have dedicated resources to answer those questions, was your testimony. We don't want to waste those resources. That was your testimony. Can you remind us how, and is it true that those resources have come from the preschool development grant? How much was that?
I think it was 27.6. It was around $27 million that we received to expend over 3 years, and those were fed as a competitive federal grant. And it really was focused on how do we improve the system. So if we use those federal funds to do an assessment on how we improve the system, and one of those key areas that has been identified is that we need an office of early childhood. That is what the Council for Thriving Children is working on. That is going to be an output of this strategic planning process. Then that is something that the legislature should be looking to and help to set up so that we can actually, again, cross the finish line, as I have said.
Just one last follow-up.
One last.
So you think that this, do you feel like this sort of aligning the legislature with the work of the investment would allow New Hampshire not to waste the federal money and actually use it productively?
I think it's a core and critical step that we align what is going on administratively with what is happening in the legislature to ensure that we are being efficient with budget dollars and that we are able to achieve this for our state.
Very good.
Thank you very much.
Yep, thank you very much. Last person who signed up is Jackie Cowell, I believe. Good morning.
Good morning. Hi, I'm Jackie Cowell from Early Learning New Hampshire. Good morning, Chairman Bradley and members of the committee. I'll be very brief. Our organization, Early Learning New Hampshire, we're a statewide nonprofit, and we were charged from 2011 through 2020 to be the coordinating body for what you've heard as Spark New Hampshire. the governor's first early childhood coordinating council. And so it was in 2018, as you heard, that some philanthropy gave some funds to get some expert advice, bring HHS to the table, DOE to the table, a lot of different community stakeholders working in early childhood. And again, early childhood had been defined as expectant families and then babies through third graders and their families. And so it was really looking at what's the best way to make sure the families are getting what they need. There's real good coordination, alignment. Consolidation maybe or maybe not, depending on what New Hampshire needed. And so there was that conversation in 2018, and then a joint report. Again, DOE, DHHS leadership at the table was submitted to the governor, and that really laid the foundation, as you heard, in 2019 when the governor asked in his budget for an Office of Early Childhood. It did not pass. But then in 2020, as you heard, in the executive order based on the recommendations of Spark New Hampshire, to form this Council for Thriving Children, the way it was formed, bringing in many different departments, a real promise of doing things differently. During the conversations in 2018, when we had some national experts guiding us, it was really looking at that continuum of doing things better on behalf of families. And so it was looking at, and that's where the early childhood integration teams of DOE and DHHS both got formed. And that was one of the continuum suggestions. Then there was the suggestion of an office that's not another layer of government, I get what you're saying, but really just a way of making the current government work more efficiently on behalf of families very thoughtfully and deliberately. And the idea of a department, some states do that, where they have a Department of Early Childhood or Department of Children. I mean, there's my organization really works to support childcare. We're a membership services organization for childcare, the families they serve. And childcare is a portion of early childhood. There's so many others as we've talked about. And so we do support this bill. We think, starting with Senate Bill 326, and while the process, the thoughtful process of the strategic planning, updating within the council, within the early childhood integration teams, that it really makes sense for this bill to start, because, as Senator Whitley said, it's not a lack of thinking or a lack of time thinking about an office. It has been thought about. We do think it's time, because the early childhood integration teams have been so well set up, that is the next phase. And having this simultaneously staying alive while the council and the department and the stakeholders and the two departments and others are thinking about the best way of doing this, having this bill there and alive, I think makes it much more likely there'll be an Office of Early Childhood in a timely way as this process continues. So I am concerned about the gap. When December 2022 hits, where's the funding coming for the council's work? Technically, it's not there. And so I do think having an office set up will be supportive of this systems building.
One question?
I got a limit, okay. So just a clarification about that gap. So you're concerned, the gap that you're identifying is when the preschool development grant runs out, you're concerned with what happens?
Right, the structure. This whole idea of the Council for Thriving Children, which is supported by preschool development grant dollars now too. And then again, if simultaneously we're working on developing this office through the legislative process, I think will be helpful.
Thank you.
Okay. I don't see anybody else signed up. Is there anybody else? Oh, I'm sorry. One question.
Yeah.
Just to be clear.
Yeah.
And it sounds like it's clear. The Council for Thriving Children believes that this type of structure is the appropriate next step. Is that the conclusion of the council, or?
So the roadmap for the council, to be clear, the roadmap that the council was designed to follow is the New Hampshire Early Childhood Strategic Plan. In the Early Childhood Strategic Plan, which was developed before the council formed, is the recommendation that there is an office. So the council is following that roadmap. Great. You're welcome.
Okay, thank you very much. Is there anybody else wishing to testify? Seeing none, We'll close the hearing. We should have an opportunity to exec and we can discuss this bill a little bit further. So let's move right along to the next bill. Open the hearing on Senate Bill 337. I don't see Senator Prentice here. She's here. Good morning, Senator. How are you?
This chair has a little bit of a dip in it. Did it? Okay.
Watch
Well,
out,
good.
Sherman.
Good morning. Okay, so good morning, Chairman Bradley, members of the Senate, Health and Human Services. For the record, my name is Sue Prentice. I'm a state senator from District 5, covering the wonderful Connecticut River Valley. And I'm here to talk to you today about, or to testify, well, introduce and add my commentary to Senate Bill 337. This has been requested by the New Hampshire Department of Safety. It's to clarify language. It's to clarify language in both RSA 21P12B and 153A35 Section 2 regarding the sharing by formal request of EMS and trauma data for the purposes of research and medical services at the Department of Safety. We built an electronic data reporting system and we're for our pre-hospital care providers for their medical records, and we were the second state in the nation to actually send data to the National EMS Information Data System. It was a major accomplishment. It was recognized for the department and the state in our nation. So that data is, we are already submitting this to NEMSIS. The data, which is our data, is maintained. It has valuable information that we could and should be using to continuously improve our EMS and trauma system operations and care that's provided. Without the research and analysis capacity at the Department of Safety, opportunities present themselves at the federal and state level that upon request we can take advantage of to do this work. Updating the language would allow for a state or federal agency or a third party contracted by a state or a federal agency to work on our behalf to request and access this data, provided such request for use does not violate any confidentiality of the recipients of emergency medical care in New Hampshire. All requests for EMS data are reviewed by a privacy committee that has been established under 153A35, and final approval to share this data under contract would be done with the consent of the Commissioner of the Department of Safety. So I'm asking you to please support Senate Bill 337, and therefore by supporting the efforts of New Hampshire EMS, the Department of Safety, and our wonderful emergency medical services providers in continuously improving the work that they do by allowing this data to be shared when requested for, again, analysis and research that we don't have the internal capabilities to do, but they exist. So with that, I will close my testimony. I do have two, although Cam, I wrote some notes on it, I'll give this to you. It's my testimony, and I have letters and emails from, one is from Dr. Jim Swosey, and he's from Cheshire Medical Center. He's the former chair of the EMS Medical Control Board, and he works with 911, and he supports this data, he supports this bill, gives his explanation why, and I also, and you should have received this ahead of time, have an email from Rob Ricks, Dr. Ricks. He is the current chair of the Medical Control Board, so this is a group of emergency medicine physicians that work on protocol and trauma system development in the state of New Hampshire. So I'll give those to Cam as well. And I'm happy to answer any questions you might have. I note that there's at least 2 members from the Division of Fire Standards and Training and Emergency Medical Services that are here as well, that if I can't answer the question, I trust that they can. Thank you.
Any questions? Seeing none, you are good to go. Okay, Nancy Vaughn from the Heart Association has signed in support, doesn't wish to speak. and Justin Cuddy, I believe, from New Hampshire Fire Academy. Good morning, sir.
Thank you, Mr. Chairman and Senators of the committee, for allowing us to spend a few minutes with you today. My name is Justin Cutting. I am the Director of the Division of Fire Standards and Training and Emergency Medical Services. In support of this bill, we had a few comments, but in respect of your time and not repeating what Senator Prentice said, I'll save those comments. We would just like to thank her and the other sponsors of the bill for bringing this forward. We think it's important, and we'd be happy to answer any questions you have.
Other questions?
Thank you.
Seeing none. I don't have anybody else who signed up to speak. So we will close the hearing and move to the last bill of the day. Senate Bill 289, and recognize Senator Sherman.
Thank you, Mr. Chair. For the record, my name is Senator Tom Sherman, District 24 at the Seacoast, and I am introducing SB 289 relative to Glucagon administration. And if there's ever a statement of power and brevity, this is it. If you look at the statute that this addresses, throughout the statute, it uses the term Glucagon administration, except at the title or the section heading. And there it says glucagon injections. Glucagon is now able to be administered by nasal route, and basically this brings everything into consistency, recognizing both the ability to inject or use the nasal version. Happy to take any questions.
Is this as simple as it seems?
It's as simple as it seems.
Then, seeing no questions, I'll close the hearing. Senator, actually, there was, I'm sorry, somebody else who signed up to speak. Brittany, you just want to say it's as simple as it seems?
I'd like to back up. I did write testimony that you can all bring with you and not make me read. So there's some copies. And to show you that it's as nice as it seems, this is what you normally have to do. This is what it covers right now. This would, if you were to give this to a child in school, and this is really what it covers, the person has to be trained to inject this into this vial, leave it in the vial, gently roll it, give it a 90-degree angle. There's a multitude of steps that's explained in the testimony. Now, glucagon comes this way. It looks like a Flonase, and all you have to do is put it up one nostril, one dose. Your unconscious diabetic is now conscious, hopefully. And this will help cover children in schools that would prefer to do this over waking up being jabbed with this.
Excellent.
Thank you.
Wow. Seeing no questions, you get an A+ for illuminating everybody with brevity.
Thank you. Thank you very much.
That's the illumination part. Okay, we're going to close the hearing on Senate Bill 289. Senator Avard has moved to exec, and I think he's going to move Senate Bill 289 first.
So moved.
Ought to pass. And it's seconded by Senator Sherman. Any discussion? All in favor say aye.
Aye.
Aye. Any opposed? Senator Avard moves consent. Seconded by Senator Sherman. All in favor say aye. Aye. Senator Sherman, you get the honors. Okay, I'll try to make this as easy as possible. Let's do Senator Prentice's bill, since that's fresh on everybody's memory.
Second.
Second. Seconded by Senator Whitley. Seems common sense to me. Doesn't undermine privacy, but allows data sharing.
Can you just say the bill number? You haven't said the bill number
I'm sorry. Senate Bill 337. Senator Sherman moved on to pass, seconded by Senator Whitley. Any further discussion? Seeing none. All in favor say aye.
Aye.
Any opposed? Senator Avard moves consent.
Second.
Seconded by Senator Whitley. All in favor say aye.
Aye.
All right. Senator Whitley can take it out. Sure. Okay. Next on my hit list is Senator Ricciardi's bill. I think we should hold on this, waiting for an amendment to cover mandates, state mandates. I think it's kind of implicit in the bill, but let's make it explicit.
Yeah.
So we'll hold on that one.
We already did the autocracy, right?
All right, let's have a discussion about Senator Whitley's bill while we're here. Okay, so here's my view. I think I think the threshold issue of creating some kind of an office has been established, in my view. So I'm going to tell you the same thing I said on your bill last year.
Yeah.
That ended up in a pilot program for the eligibility and enrollment in daycare centers. That one had a huge fiscal note. This one really is a pretty sparse fiscal note.
Yeah.
I think more work needs to be done. I will say I think that a commission is the better way to go. But if you can bring the departments under the banner of, like these two departments, DOE and DHHS, and Administrative Services and the Office of Childhood Advocate together in a realistic time frame, agreeing on how to do this, and have some sort of language in it that is going to give the Finance Committee certainty as to what the costs are going to be, then I'll keep an open mind to it. I happen to think that in an off-budget year, you're better off with a commission that would be tagged with a report that would have to come out in November or December that could be entered into the next budget, that outlines all the things that need to be outlined, starting with a purpose statement, starting with some of the duties, and with a goal of establishing that office. But if you can convince the committee that the route that you're trying to go is better, I will keep an open mind.
Yeah, so, and I appreciate that. I mean, the reality is that creating a commission would be completely redundant. We already have the Council for Thriving Children who got $26 million. They didn't get the whole grant. There has been a $27 million investment in figuring this out. They got the money, so let them do the work. They're going to have a report in November that will then give the Senate, as they go into the budget cycle, a sense of what this will cost. But we need to get the legislature fully aligned with that work. I feel like we're going to waste federal dollars if we don't move forward with this. The governor's on board. It's a bipartisan solution. Everyone thinks that the office is the right step. There certainly are questions that will be answered by the strategic report that they're planning to issue in November. Let them do that. This bill fully tracks with their work and just takes us, it aligns the legislature with that work.
And I'm not disagreeing with it, but it also establishes the office of a commissioner. It allows sort of use of other department staff, doesn't have an appropriation.
But that's eventually, that's what the working group will do. Figure out what staff is necessary, who's going to come over.
Again, I'm keeping an open mind, but I think we heard pretty strong testimony from DHHS and fairly strong testimony about some outstanding questions from education.
And Senator, you didn't hear the full testimony of Rebecca Wojtowski, who said,
sorry.
Yeah, and basically she had equally strong testimony that this has been studied ad nauseum, that this is necessary to move forward. You also heard that from Jackie Cowell. The roadmap, every single roadmap that's been developed says create a new office. We just got to do it, right? So this is a baby step forward. My bill is a baby step forward.
Okay, all right. Senator Gray.
I could go further, my friend, but this is a baby step.
Senator Gray, then Sherman.
I've heard several
Senator
times.
Gray, can you turn your mic on?
I've heard several times that the governor's office full support of this. Governor can take people from other departments, give them either collateral duties or other duties, and have them do just what you've got in this bill. If that is the case, that the governor is in charge of this, I look at this and I say, okay, well, gee, we've got Department of Ed because I've got responsibilities all the way down to 3-year-olds who have in need of services. I've got DCYF, I have got, and you've got to coordinate all these. And to get there, if the governor really does support it, he can go do it.
Senator, with all due respect, he tried to do it in 2018. He was looking for legislative support. We have 3 branches of government. We have an obligation to do our part, and the governor did try to do it. He couldn't get the legislative support. Now there is bipartisan support. We have a roadmap. We have a council. He took the intermediate. He proposed it. Legislature wasn't ready. He created the council. Look, now the legislature's ready. It's 4 years later. Let's get together and do this.
And if that's the case, then the governor can have somebody come either testify before the committee or give us those directions.
Right, and that's why we have the council, because it is the designated governor's council.
Senator Sherman.
Yeah, I think that the most important part of this is, I agree with Senator Whitley's bill. I agree with the idea of having, it's almost like we know that next November, we have to have something on which the decisions coming out of the council can land. At the same time, we're going to be putting in a budget for DHHS, the Department of Education, and possibly, if this moves forward, the office. What I've heard today is everyone's in agreement. Number 1, that there needs to be an office. Number 2, that there needs to be, that this would be great to have in place as the council finishes up their work. Number 3, that there would be, to answer Senator Avard's questions, there would be economies of scale. There would be increased efficiency. You wouldn't have the same thing being done in the Department of Education that's being done in the Department of Health and Human Services. You'd see that this office would be the office of coordination, basically. So the only problem I have is making sure that that skeleton that this bill creates is something that everybody on the council embraces and moves forward. And I'm not hearing that from the Department of Health and Human Services because they were not fully endorsing this moving forward. I heard more support coming from the Department of Education, and I heard a lot of support coming from other members of the council. So I think this is the right solution. I think if it doesn't happen, you're gonna have a delay beyond the budget year. You're not going to have a budget that anticipates this office. This office won't exist yet, and it will be much more complicated.
I just wanted to address that issue. I mean, the reality is that the governor told the council to do this. The council developed a strategic plan that says, do this. I mean, it's the departments, I feel like, that are dragging their feet a little bit.
Well, that's what I'm saying,
yeah,
is
and-
that they need to be aligned in the
Yeah.
structure
All right,
here.
so let me, I don't think you're hearing from us disagreement
Yeah.
about creating an office. I don't think we're saying that. I think what we're saying is, you gotta dot your i's and cross your t's, and I wanna see the two departments that are largely gonna be affected by this under the same umbrella. Okay?
Right, and
you've got a little bit of time to do it before we have to exec it and move it to finance. And we will have a conversation with the governor, as can you, obviously, and then, hopefully this bill can move forward, okay?
I think that makes sense. That, it's also, change is hard for sort of pulling things out of departments. They may not always be fully on board, but we have a directive from the executive branch, and the executive branch needs to go along with that directive. I will say that the Office of Child Advocate just submitted a letter in support as well.
Okay, so, next bill I think we can take up is 281, which is Senator Gannon's bill that dealt with nursing home vacancies. I think we asked him to produce an amendment, which everybody should have.
Yep.
It's Amendment 103. Does everybody have it?
Yep, still looking.
I have one extra
Yes,
copy.
I have copies. Lucas is handing them out.
Okay.
I have it, please. It had to do with the,
I think this was if I'm recalling correctly and looking at the hearing report, a technical amendment, deals
the
with,
property being removed.
yeah, property being removed and a citation of not more than 10 days. And I believe that's consistent with the testimony of the association which supported the bill.
A motion to approve?
Can I
Yeah,
see
go
if
ahead.
you'd be open to a committee amendment? I brought this up to Senator Gannon. Rather than the word passes in line 7, if we could say the resident dies.
I thought you wanted,
But that's on the amendment.
I thought you
I have the
wanted
amendment.
dies, not passes. Or I thought you wanted passes, not
No,
dies.
No,
no,
death.
the original said passes.
Notice of, in the event of resident's death. It's line 7, right?
No, line 3, line 6. Line 7, in the month in which the resident passes. That's not
You want dies instead of
dies,
passes?
yeah.
Okay. Everybody okay with that?
Yep.
Yep.
I do remember that.
It's just not
Just
a term.
Okay, is that it?
Yep.
All right, so Senator Avard has moved it with that change. Senator Sherman has seconded it. Any further discussion? All in favor, please say aye.
Aye.
All right, is there a motion of ought to pass
So moved.
as amended? Senator Avard moves. Senator Sherman seconds. All in favor, say aye.
Aye.
Consent?
Senator Avard moves consent. All in favor, say aye.
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 Who wants the honors? Senator Avard gets the honors. All right, the next one, I think that's ready is Senate Bill 283, which was Senator Avard's bill on the membership of the Council on Autism Spectrum Disorders. I think we suggested an amendment that the 5 additional members be nominated by the council and appointed by the governor. And that's reflected in the amendment that I have under your name.
Do you have the amendment?
0086.
And there was the additional, was that the quorum was also added in, is that correct?
Yep, that's at the bottom.
Yep. I move ought to pass on the amendment.
Second.
Okey-doke. Any discussion on amendment 0086? Seeing none. All in favor of the amendment, say aye.
Aye.
Any opposed? Senator Avard moves ought to pass as amended. Any discussion? All in favor, say aye.
Aye. Consent?
Senator Avard moves consent. All in favor, say aye.
Aye.
I'll second those motions. Retroactively.
All right, so we have discussed, Senator Avard gets that one, thank you. All right, so Ricciardi's bill holding, Senator Whitley's bill holding, Senator Sherman 280. I think we're holding on that.
Right, we have a meeting.
Okay.
Or we're trying to get a
Holding on that. Senator Avard's bill 288. I'm working on an amendment that would give greater oversight. So holding on that if that's all right. The only other bill that we have, which we can discuss now and potentially take action on or hold it, depending on what people want to do, is Senator Rosenwald's bill, Senate Bill 319. Senator Sherman.
I would move on to pass.
I'll second.
All right. So Senate Bill 319 is the mandatory vaccination wellness program. I'm going to let
No,
you.
it's not mandatory.
Well. Okay, go ahead. Senator Sherman, speak.
Let me pull it out and then. It's mandatory, but it doesn't provide, that was 319.
May I?
Go ahead.
Go ahead, Senator Whit.
Yeah, so I think the part that Senator Sherman was referring to is that it is completely voluntary for individuals, right? Right. So, we didn't hear opposition really from the insurance carriers. Look, I think we all, the governor has indicated that we want to end this pandemic, and we do that by vaccination. So this is a small, non-coercive tool to do that. So it feels like a no-brainer to me.
All right, Senator Sherman.
Yeah, there have been many who have said that the cost of the unvaccinated, right now the cost of the unvaccinated is huge. Nationally, estimates by the Kaiser Family Foundation is that an unvaccinated person costs per person $20,000 because of their differential care needs in the intensive care units and otherwise across the country. These are based on studies. And there's been an estimate that when admitted, when an unvaccinated person actually gets COVID, the differential in severity of their illness puts the cost of that admitted unvaccinated patient at an average of $50,000 per patient. So this bill stays within the allowed law It allows participation, but it doesn't force participation on any individual. But it recognizes that those who are vaccinated are bearing the brunt of the cost through their premiums and tax dollars for those who are unvaccinated. It's not particularly controversial. It is something that I know there are people who push back, but this is not a bribe. It's not any of the things that were said in the discussions or in the testimony. It really comes down to the cost differential and making it possible for people to have a wellness incentive built into their premiums, built into their program that would recognize the cost savings and the health savings of a vaccine, which are the science. I mean, I can produce many, many peer-reviewed articles that show the health benefits of this. It's not in dispute in the medical or insurance community. Actuarials could bear this out. And so I think this is a baby step that allows that to move forward.
So let me just say a couple of things. I recognize that the insurers did not testify last week. I wish what they've told me privately they had testified to. I think there are some significant problems with this bill. First of all, I don't think there's anything that prevents a carrier today from offering a wellness incentive. In fact, they often do, but those costs are recovered. There's a specific prohibition on recovery in the bill, so I find that to be problematic. The second issue that I find to be problematic is that the bill as written only applies to about a quarter of the insured people in New Hampshire, and those are in the small group employer insured market. Other people that are in the individual market that are covered by ERISA plans or self-funded plans, Medicaid, Medicare, would not fall under the mandate to offer this incentive. So it's pretty small in its targeted areas. Then the issue, I think, becomes how does it comply with federal non-discrimination law? So in order to comply with that law, I believe the wellness incentive, whatever it is, and it's undefined, would have to be offered to everybody that's already vaccinated. Not only would it have to be offered to everybody that's already vaccinated, it would have to be offered to those that have a condition that, a medical condition that precludes them from getting vaccinated, and it would obviously have to be offered to those that are unvaccinated. So the scope is, I think, a lot bigger than what the sponsors have determined it would be. Lastly, no definition of the wellness incentive. And I guess I would say that for those people, and I'm not one of them, I'm fully vaxxed, I'm boosted, so far so good. I've made my own risk analysis and decided the benefits of vaccination outweighed the risk. But for those people who've come down on the other side, about, a quarter of New Hampshire, although my understanding is from the U.S. News and World Report's ranking of states, over 90% of eligible people have had at least one shot, and we are the top state in the nation there. But for those who remain unvaccinated, I just question whether a small wellness incentive is going to move them if they're willing to relinquish their jobs. So for those reasons, I think I would be opposed to this bill in its current form, especially lacking recovery for the costs of the carriers, because of it's not just targeted to those. It can't be just targeted to those that are vaccinated. There has to be it has to be eligible for everybody, or else you're going to run afoul of discrimination requirements.
If I could withdraw my motion, I would like to talk to the prime sponsor and see if she wants to talk to you. I've written down your concerns, and we could exec this next week.
Okay.
Support that.
Before we go out of this, my concerns, we had a long discussion on may and shall in the bill, and we haven't mentioned that right now, okay?
Right.
So that also is an issue that has to be solved for me, and just so you know.
I'll be happy to take it back to the prime sponsor, and I'm sure she'll want to talk to you, Mr. Chair.
And there's that concern of inducements that I'm concerned with, but I'm really not for this bill, but as written.
Yeah,
So
I would just say too, you know, we do know that there's data out there that incentives do work. We do know that we're in a surge. So it is, I think it's well established that incentives do increase vaccination. So I just wanted to make that clear.
I think the biggest incentive right now that's increasing the rate of vaccination is people realizing that they're not going to get as sick if they get COVID, which they're likely to get. And people are getting vaccinated now. So in any case. So before we adjourn, I have 288, 280, 326, 286, and 319 that we haven't exec, and I think we've done every other bill. We have hearings tomorrow from 10 until we're going to have to wrap about 12:30. Do we have the list of those bills?
No, I don't have it today.
Okay. 4 bills or 5? 5.
Put them on.
Okay. So we're getting through our work, but the folder of those still that have hearings is big. Okay.
Motion
to come out of exec. All in favor, say aye. Any opposed? And a motion to adjourn.
Second. So moved.
Let's go.
Seconded by Sherman. All right, we're adjourned. Thank you. See you tomorrow.
Hit your button to call. Hit your button to call.